All right, welcome once again. We are diving into mastering Next Gen NCLEX case studies. I am your tutor, Dr. Julia. Always remember that the power of your clinical judgment will be tested as you write in the NCLEX. It's not always going to be about what you have put into your memory and you're trying to recall. You have to understand. So for NCLEX, like we always say, content is key. Content is key for the NCLEX. So today we're going to dive into some case studies, and that will help us build our muscle in these areas: recognizing cues, analyzing cues, prioritizing hypotheses, generating solutions, taking actions, and evaluating outcomes. So when you look at all these spots that you'll be tested on as part of your exam, when you count it, see, we have 1, 2, 3, 4, 5, 6. So for every case study that you will see in the exam, you will be having it in 6 parts. So you start with question 1 of 1, question 1 of question 2, it goes to 3, 4, 5, 6 on that same question. So we're going to do that here as well. So let's start with this. So it's very important that when you are doing the case studies, you maintain your composure. Do not get lost when you see a lot of the vital signs and the history about the client, the past medical history, everything, the labs. Do not get confused. Just maintain your composure and then be able to pick up all the areas that needs to be addressed for that client. So I think I would let you look at what we looked at last week from the website. It is very important that you have an idea of how the case studies. Oh, girl, today. So let's look at how the case studies would look like when you are. Okay. So let's look at it here. It's very important that you have an idea of how it's going to look like so you do not get confused. Last week, we looked at the bow tie kind of question. So you can find this on the NCSBN website. Do well to go through it so that you familiarize yourself with the different kind of questions that you can meet. So I want to just get one case study so that you look at the interface and then we will dive into our questions. So this is a case study.
Let me show you.
So look at the interface for this case study.
Okay.
So when you see your screen, you can see case study 1 of 6. So you have the nurse's notes. So you tap it so you can see everything here for nurse's notes. And then you have your question, but move on, tap. So this is still nurse's notes. And then they're giving you some more details. So you do well to look at everything presented to you concerning the client, and you're going to use it to answer questions 1 to 6. So this is question 5 of that same case, and this is question 5, and this is 6 of 6. So when you get to 6 of 6, it means that you are done with that client. Then you move to the next case study. So do not get lost when you are going through your case study. Just maintain your composure and look out for the salient like findings. What will kill my patient? What can I do to make my client safe? That is all that you're supposed to be doing. So you should not get lost in any way. So I guess you've seen how I was thinking that I would get. So now let's dive into our first question. So I'll read quickly and then you provide the answers. So as I read, you pay attention to the important pointers in the history physical exam, labs, and everything. So we have Mr. Daniel Perez, 58 years. Pay attention to the age. The diagnosis is community-acquired pneumonia. His past medical history, hypertension, and type 2 diabetes. These are the medications, lisinopril and metformin. Vital signs, pay close attention to them. Temperature, 102.4, heart rate of 110, and then blood pressure, 88/56. Respiratory rate is 28, oxygen saturation is 86, and your labs, white blood cells, 18,000, glucose 210, sodium 132, creatinine 1.9. Assessment: confused productive cough with green sputum, cause crackles bilaterally using accessory muscles. We pay close attention to everything here. So the first question, which findings are most concerning and require immediate follow-up? Which findings are most concerning and require immediate follow-up? So you have to ask yourself, what is going to kill my patient? What is going to kill my patient? So A, crackles in the lungs, blood glucose of 210, blood pressure of 88/56, confusion and restlessness. So which of these findings are concerning? So you have to put everything about the client into perspective. He is 58 years. He has a diagnosis of community-acquired pneumonia, and this is the past medical history. So you have to look at everything, especially the vital signs. Look at the vital signs. So what will kill your patient? So what is the answer? Let me get some options in the chat box. So question 1 is testing the first point we looked at, recognizing cues. So this is testing you, recognizing cues.
I choose C.
Okay, you're gonna choose C. Okay, that's fine. Any other options, please? You can put your answer in the chat box. Just Fed, you can put your answer in the chat box. All right, so it's supposed to take, this one was 2. So the most concerning, 2 answers here, C and D. 2 answers here, C and D. So who chose C and who chose D? So blood pressure, so look at the blood pressure. Blood pressure is low. Blood pressure is low. And then D, confusion and restlessness. So hypotension will kill your client, and altered mental status. Hypotension will kill your client. Altered mental status is also very important. So I think this one was select all that apply. I did not put it right at the beginning. So whatever will be most concerning for our client. So indicates that the client hypotension is very important. There will be poor perfusion, and that is life-threatening. Yes, glucose of 210 is elevated, but that's not an immediate priority. So that 50, let's look at the age. 58-year-old, confused, diagnosed of community-acquired pneumonia, so there's infection, and now has low blood pressure and altered mental status. So that can kill your client. So there's shock and perfusion issue. So B is important, but that will not kill the client right away. So for the first 2, we will go for hypotension and altered mental status. Hypotension and altered mental status. I hope we are all good. Any confusion here? Okay, so we're still on the same patient. So number 2, we want to analyze the cue. This is also a select all that apply. So which lab or assessment findings support the hypothesis of sepsis? Which lab or assessment findings support the hypothesis of sepsis? So WBC, white blood cells, 18,000, oxygen saturation at 86%, sodium 132, productive cough, and heart rate of 110. So do not forget the case. Which lab assessment will support the hypothesis of sepsis? So let's go. So let me even take you back to the main, always go back to the main case. So what will point to sepsis? Mr. Perez, white blood cells, 18,000, oxygen saturation 2 was given, and then was the other one, productive cough, and then heart rate 110. So let's go. What will you go for? So we are analyzing the Q. We have identified what can kill your client. So for every case study, you will be going through those motions. What will kill your patient? So let's go. Let's.
A and E.
Okay, you're going to go for A and E. Okay, white blood cells, 18,000, and then the heart rate. So what, any other? Let's get another option and you go. So this one is also select all that apply. So SATA, select all that apply. All right. Let's go. Let's check. Yes, so A, B, and E. A, WBC, then B, yeah, yes, A, D, and E. Well done. Well done, please. So WBC, so if your white blood cells are high, yes, then infection, yes. The oxygen saturation, it cannot support the hypothesis for sepsis. Sodium, it will not support. The client has productive cough, yes, likely infectious. And then the heart rate increase. So high white blood cells, hypoxemia, and tachycardia aligns with infection or sepsis. So remember, mild hyponatremia is not the primary indicator for sepsis, and cough is expected the client had pneumonia. And so A, B, and E, I hope you got it, A, B, and E. So for SIRS, there's a criteria. You have a criteria for SIRS. Temperature, high. Heart rate is high, WBC, and then we have issues with the respiratory rate. So these are all red flags for sepsis. So pay close attention to this. D is not part. A, B, and E. We expect that if a client has pneumonia, yes, it's infectious, the client would have productive cough, but it's not a marker of sepsis. So it goes for infection, yes, but it is not a marker for sepsis. So for sepsis, this is what you should look out for. Temperature elevation, heart rate elevation, which we had in the client, WBC elevation, and then we have issues with the respiratory rate. So still on the same client, we are moving on to prioritizing the hypothesis. So now that we've identified the issues, you are being asked, rank these possible problems in order of priority. So how are you going to address them? So arrange it in order of priority. So always have the ABCs at the back of your mind, your airway, breathing, circulation, and then use it. What you're going to take first. So which one? Hypoxemia, hyperglycemia, hypotension, productive cough. So which one will be number one? Which one will be number two? You can arrange it in the chat box. Let's go. So just put yourself on the word and how you're going to address these issues. Hypoxemia, the oxygen level is low. Then hyperglycemia, glucose is high. Hypotension, blood pressure is low. And then the productive cough. So which will come first? Okay. All right. So Nat chose hypotension as your number one. Okay. So what will be your number two? So you see that case studies are kind of involving. It's not about what you have crammed and you are trying to recall. You are remembering the content, what you have studied, and then you are applying it in a clinical situation. So you need to like really understand everything that you are studying so you can apply it here. So we want to prioritize the hypothesis. So what is going to be? So we have hypotension, then what next? Matt, what will be your second? So just put yourself on the ward. You have your client whose oxygen saturation is low, and then glucose is high, blood pressure is low, and the client has productive cough. So which of them are you going to attend to first? And always ask yourself, what will kill the client? So
The first, sorry.
All right. So yeah, you can.
Yeah, hypoxemia, hypotension, productive cough, and hyperglycemia.
You okay? So you brought productive cough first. Before the hyperglycemia. All right, that's fine for darling. So Nat also chose hypoxemia first. Josephine chose hypoxemia first. Hypotension next. Yeah. Then is hyperglycemia. And then the productive cough. Okay, let's see who got it. Well done, everybody. So yes, hypotension, if you're black, then hypoxemia, then hyperglycemia. Productive cough is last. Cough is last. So I think I would say that ABC, airway, so hypoxemia, should even be first. Okay, let me clarify. Hypoxemia should be first. So Josephine, got it. Hypoxemia has to be first. Always remember your ABCs. Hypoxemia has to be first, then hypotension, and then hyperglycemia, then productive cough. Yes, that's also choose hyperglycemia for the. Then productive cough is an expected finding. So that should be your last. So I hope we are all good here. I hope we are all good here. Yes. Yes. Come. So still on this client. Question 4, we are generating solutions. So which provider order should the nurse implement first? So this is what we are doing. We've identified the issues. So we now have to solve the problem. So what will we solve first? Administer 500 ml IV normal saline bolus, start IV antibiotics, obtain sputum culture, and then apply 2 liters per minute oxygen via a nasal cannula. Let's go. What will you do first? So we have these orders. What will you do first? So let's always go back to, okay, so we have A and we have D. So let's not get confused. Let's always go back to the question. So see the vitals, heart rate, see the blood pressure, respiratory rate 28, oxygen saturation 86. So let's just look at the parameters here. Which one will affect your client first? Looking at the situation at hand. So put everything in perspective. Don't just take blood pressure and deal with it. Put everything into perspective. Your client has community-acquired pneumonia. He's 58 years, and his blood pressure is 88/56. Are you happy about it? His WBC is 18,000. Oxygen saturation is 86. So in this old man, which one will kill your client first? Which one will kill your client first? It's the blood pressure. Okay, it's the blood pressure. So we're going to give IV fluid bolus because the blood pressure is low. So we give IV normal saline bolus to correct the blood pressure. So antibiotics are crucial, but we have to stabilize the circulation first. Then cultures before antibiotics, but that's not a priority here. Oxygen will help, yes, but perfusion is more important here. We want to solve the blood pressure issue before oxygen. And remember, we are dealing with a case of sepsis. Okay, we are dealing with a case of sepsis. So your blood pressure being low is concerning. And so you should give your fluids first. So I'm even, you know what? I'm even thinking that, yes, we have to take the answers provided here because we are dealing with a case of sepsis. For case study, you have to put everything into perspective. So it just dawned on me that, yes, we are dealing with a case of sepsis and the blood pressure being low is concerning. That has to be addressed first, okay? That has to be addressed first before hypoxemia. If you were dealing with a case of COPD or a case of asthma, which is respiratory, and then we have clients having issues with the saturation, hypoxemia would have been dealt with first. But in this case, our diagnosis is more of sepsis. Okay, the client has pneumonia, the white blood cells are up, there's tachycardia. We have to solve the blood pressure issue first. So I hope we got it and there's no confusion here. So that is why it's not about cramming, it's about understanding so you can apply it. So this is a case of sepsis, the blood pressure is low, we will do fluid first to save our clients. Are we all good? Hope there is no confusion here. Okay, so let's look at, we are still on the same case study. This one is about taking action. Put these nursing interventions in the correct order. So you have that client before you. What are you going to do first? So apply oxygen, reassess the vital signs, start IV fluids, notify the provider, and then draw your blood for cultures. So let's go. Let's go. Do not get confused. That's how case studies are, but you have to maintain your composure and then think through it because you have all the answers within the question. So let's go. Yes, great. Well done, peace. You start your IV fluids, then what will be next? Yes, not great. You start your IV fluids, always put the case into perspective. You don't have to get confused like we were getting confused to do hypoxemia first before fluids, but this is a case of sepsis and the blood pressure is low, so that should be addressed first. So yes, you've handled the blood pressure. So what will be next? What will be next? Let's go. What will be next? Yeah, apply your oxygen. Then, okay, so darling would start the IV notify provider. Then what is your third? Okay, draw cultures. So
Sorry, I would notify provider is in third position because I will start IV fluid and after apply O2 and notify provider.
okay, so
After draw cultures and after we assess VS.
the vitals. Okay, let's see. So look at it. So you have to start your IV fluids. We all agree, yes. Then you apply your oxygen. So you're on the ward. So client is here with you. Blood pressure is low. Yes, start your IV fluids. Oxygen saturation is dropping. You're applying the oxygen. You don't have to go and notify provider before applying. Yes, there is a case of pneumonia. We will surely need blood cultures before we start our antibiotics. So you've done that. So you know that you have handled all the urgencies for your client. Then we notify provider. Then we reassess whatever we have done. We have given IV fluid. So let's check how is the blood pressure doing. We have given oxygen. So let's check how the saturation is doing. So immediately stabilize your circulation and your oxygenation. This is what the question is all about, to stabilize your client first. Then also to help you understand that you have to take your cultures before we give the antibiotics. And then we notify provider, and then we reassess to see whether our interventions have worked. So what you're supposed to pick from this question is that you have to stabilize your patient first. You intervene, and then you do not have to start giving antibiotics when you have not done like your investigation. So the diagnosis is important before antibiotics. Then notify provider, and always remember you have to reassess to see whether your intervention worked or something more is needed. Okay. I hope we are all good. So we are still interested. You are still on the same question. So we're on the last part of the question, 6 of 6, evaluating the outcome. Okay. So you've done all your interventions. Which finding will show that your client is improving? So you should know what to look out for. So oxygen saturation has now come to 94. Blood pressure remains 86/54. Heart rate is 122. Still tachycardic. And D, still confused and restless. So what would you be happy about? Okay, Nat says A. Oxygen saturation. Yeah, looks like we all, yeah, this one is a simple one. So oxygen saturation has moved to 94. Yeah, so that shows that the gas exchange has improved. But with B, C, and D, it shows that client is still not improving and we still have to intervene. So I hope this has been a good exercise, and remember that when you have your case study, you have to think through. It's not about cramming and then pouring it. No, you have to look for the cues in the question, look for the vitals, and every important pointer in there, you have to look for it. You analyze it, then you prioritize, and then you act, and then you evaluate. Okay. And when we looked at the question, look out for keywords. The client was confused, and then there was hypotension. So that should point to a perfusion issue. So that was why the first thing we had to do was to give the fluids. Okay. And when we are taking care of a client and it's a case of sepsis, remember this order, especially when you have hypotension. Remember, you're going to, although we have ABC, airway, and all of that, ABCs, in this client is a case of sepsis and with hypotension. So fluids will come first to give your oxygen. And always remember, anytime they are giving you drug and then an intervention and it's an infectious case, remember you want to do your intervention first. You don't jump to starting the medication. Okay, so that's very important. So always remember, you have to stabilize your clients first. And if you have diagnosis, you have to diagnose, but you have to make sure your client is stable. So if there's an option saying you should stabilize and an option saying you should notify provider, if you choose notify provider, it means that you are not the same nurse, because my blood pressure is low, my oxygen saturation is bad, and you want to go notify provider first. You know, you're not safe. So remember that. And then for every question, you see, is a build up from the previous one. So do not treat it as separate. So that was why with that question, when we had to decide between the hypoxemia, yes, and then the other option, hypotension. Remember, we realize that no, because when you treat the question in isolation, you may go for oxygen saturation, hypoxemia. But if you put it in context, you realize that no, this is a case of sepsis, Client is confused now. There's hypotension. So it's a perfusion issue. So I should give IV fluids. So we have another case, but our time is almost up. Let me see if I can run through. I want you to still have a feel of the case study. But has case one been helpful? Let me know so I will run you through this one quickly and then we can end because we could not start early today. So if you are for the second case, kindly give me a thumbs up, then we can move on. If not, we will end. I want to get your approval for the second case first before. But how has the first case been for you? Was it a good exercise? Has it exposed to case studies and the need to do more of that? Because it's not about recalling, it's about understanding and then applying. And interestingly, okay, I got a thumbs up. Interestingly, that's what your assessment, part of your assessment will be on. So see, this is a CPR, the candidate performance report that candidate will receive when they do not pass the exam. So apart from the report on the various areas, you also have a report on clinical judgment, and this will be taken from how you handled the case studies. So your clinical judgment, recognizing cues, analyzing the cues, prioritizing, generating solutions, taking actions, evaluating outcomes. So the candidate got below for all of that, below the passing standard, You have to get above. So below. The candidates did not make it. So it's very important you train yourself in that area of clinical judgment. So let me quickly run through this. We'll just do some few questions and we end. So it's important that you take time to review diabetes and also diabetes ketoacidosis, which is a complication. So let's look at this. So this is your client, 19 years, a college freshman, Liam Anderson. Liam arrives at the ED with nausea, vomiting, fruity smelling, breath, and confusion. His roommate says Liam has been drinking gallons of water and lost 15 pounds in a month. Pay close attention to everything given here. These are the labs. Glucose, 725 milligrams per DL. Look at the potassium, 6.5. So normally with Next Gen, when you have these labs provided, you have the reference ranges in brackets. So you are able to just compare. So it helps you to know how the labs are going. Okay, so sodium 132, but at least have an idea of some common labs in the reference range, but mostly you have the reference range. So pH, this bicarbonate 12, ketones positive, pH is 7.05. So in recognizing cues, so I'll be running through quickly for you. Which finding will suggest diabetes ketoacidosis? Fruity breath, weight loss, too small respirations, bradycardia, low BP, edema, cold, clammy skin, tremors, hypothermia, and confusion. So this, you are applying your content on DKA. So let me show you. Yeah, we just run through. So the answer is A, okay? The answer is A, fruity breath, weight loss, and then the small kind of respiration. It is a kind of hyperventilation, compensatory hyperventilation. So fruity breath is as a result of the ketones accumulating. Then there's polyuria, client is urinating a lot, client is drinking a lot, polydipsia, and the client is losing weight, okay? So this is classic. So when you see fruity breath, And then the respiration, client is hyperventilating, the Kussmaul kind of breathing, go for this diabetes ketoacidosis. Okay, so it's as a result of the acid-base imbalance. So you connect the respiratory pattern to the acid-base imbalance. Great, so that is the answer. So recognizing the cues, you notice that client has fruity breath, there's weight loss, Kussmaul breathing, it goes for DKA. The others, no. Let's look at the next one. Analyzing the cue. We got the lapse. So which of the abnormalities is most life-threatening? Which one will kill your patient fast? Glucose is high. Potassium is high. Sodium, borderline low. Then bicarbonates. Which is life-threatening? Yes, it is B. Anytime you see hyperkalemia, see 6.5. 6.5 is high because potassium is 3.5 to 5.5, and you have 6.5. That is too much. The heart will be in trouble. So hyperkalemia is immediately life-threatening because of fatal cardiac arrhythmias, okay? So all the others, yes, severe hyperglycemia is dangerous, but this will affect the heart and it will kill the client quickly. The hyponatremia is mild, which is not deadly. Then the low bicarbonate is showing the acidosis. Okay, so your priority here is the potassium. Okay, always look for the labs that will kill your client fast. So if you have potassium issues, the airway is blocked, the client is bleeding too much, go for that. So let's analyze the hypothesis. What will be your priority concern? Your priority concern. Arrhythmia, infection, knowledge deficit, fluid overload. Which will kill my client? It's A. Yes, arrhythmia. Okay, so it is A, the risk for arrhythmia. That is a priority. Okay, great. So which interventions would you anticipate that you do for your patient? So we are generating solutions. So it's a select all that apply. So IV, regular insulin infusion, fluids with normal saline, oral potassium supplements, continuous cardiac monitoring, IV glucagon. So this question is just testing how your content on diabetes and then diabetes ketoacidosis, which is a complication of diabetes. So yes, let's see. A, B, and D. Yeah. A, B, and D. Continuous cardiac monitoring because of the potassium issue. IV fluids with normal saline. For diabetes ketoacidosis, hydration, hydration, hydration. Super important. And then we have to take care of the hyperglycemia by giving insulin. Okay. So regular insulin will help lower the glucose. And the good thing is that it will shift some of the potassium back into the cells. Then your normal saline will correct the severe dehydration because your client came and was peeing a lot and drinking a lot of water. So very important. And then because of the hyperglycemia risk, you have to monitor the heart, okay? So we don't give more potassium. And remember, glucagon is for hypoglycemia. So if you choose glucagon, you are not a safe nurse. So the key word here, DKA, always remember hydration, 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 insulin, 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 and then monitor your potassium, okay? That is great. So we want to take action. Take action. So which order would you question? Which order will you question? You saw this order, you are on duty, and the arterial blood gases, do it 1 hour, every 1 hour, okay? Give IV insulin infusion, okay? C, subcutaneous MPH insulin, okay? D, normal saline at 150 ml per hour. Remember, we have to hydrate the client. So you are on duty. Which of these will be suspicious? And you're going to ask, why? Why do we have this for this client with DKA? So we still have to think through this. And the answer is C. C, because NPH is intermediate acting subcutaneous insulin. But your client has acute decay with the blood sugar shooting. So we have to give IV. So you're going to wait a long time to have this working. So this is not to be done now. So it's questionable and you have to ask about it. Okay. So you have to question that order because it's not effective. You are dealing with an acute issue. Okay. So monitoring is important, correct treatment, and then fluid therapy. So C is out. So the last question, evaluating outcomes. So you've done everything. So what will indicate improvement? What will show that your client is now doing well? Whose small respirations persist. So the breathing is still on. Glucose is now 180. pH is 7.35. Potassium is 4.5. Remember, our potassium used to be 6.5. Blood pressure is still 84/50, heart rate of 140. Then continued ketonuria. There's ketones in the urine. So let's go. Let's go. Yeah, B. Yeah. So B. So glucose, pH, and potassium have normalized. So that is the best indicator of recovery. Okay? That shows that your treatment has been successful. Great. So yes. So please do well to go and study DKA inside out. Everything about diabetes ketoacidosis is a high yield because it's life-threatening. So look out for your cues: polyuria, polydipsia, weight loss. This fruity breath should give it away. Too small respiration should give it away. Then with the labs, the sugar will be high. Metabolic acidosis, so see the pH, then the bicarbonate. Ketones in the urine, then high potassium. And anytime you have the high potassium in this case, that is your priority because of arrhythmia, risk of arrhythmia. And for your treatment, always remember adequate hydration. We start with normal saline first before we switch to D5. Then regular IV insulin, and then we monitor potassium, okay? So the key words, give your IV insulin, then you do your cardiac monitoring. Great, so we are done for today. Let me have your feedback on case studies. Are you going to revise more of case studies so that you'll be able to recognize cues, analyze cues, prioritize hypothesis, generate solutions, take action, and evaluate outcomes. So give your feedback. We are rounding up. So as you study, remember, you're going to be tested for the NCLEX test plan on all these areas. So always make sure you are studying it inside out.